Hello everybody, welcome back. I'm Dr. Michael Sistare with Palm Beach Cosmetic Surgery. Thank you again for tuning in to another one of my videos. Today I'm going to talk to you a little bit about gynecomastia. So gynecomastia is the excess tissue on top of a man's chest that kind of gives the appearance of breasts, even though men don't have breasts. Sometimes they accidentally do. That's why I'm here. So there's two different types of gynecomastia. One, true gynecomastia is when a male patient starts inadvertently developing breast tissue. Even though we don't think of men as having breasts, all men, to a small degree, have a certain amount of breast tissue underneath their nipple on top of their chest wall. Some men more than others. For a variety of reasons, this breast tissue can get bigger and more noticeable. Sometimes it gets bigger with the addition of excess fat on your body. There are some medicines that can increase their noticeability. Chronic marijuana usage is linked to development of gynecomastia. There's a variety of reasons that a normal functioning guy can get the development of breast tissue. When it's not proper glandular breast tissue that's contributing to this appearance of breasts on a male, what's called pseudogynecomastia is when you have the abundance of fat on the chest that gives the appearance of breast tissue. We make this distinction between true gynecomastia and pseudogynecomastia because they're treated in different ways. If it's pseudogynecomastia, if the tissue that's on top of the chest is just fat, most of the time that's amenable to liposuction. So we inject tumescent fluid underneath your skin, and we can remove that excess fat with a liposuction cannula, a tube with a hole on the end connected to suction. And then the following months after your procedure, the skin on the chest wall sucks down to the chest wall and it gives you a more contoured masculine appearance. If you have true gynecomastia, that is the propagation of breast glandular tissue, that is not amenable to liposuction. It's more adherent to the chest wall, and that requires direct excision. It requires an incision at the boundary between your normal skin and your nipple, so it's well hidden. Through direct excision, we go down and remove the tissue that we find. If you have a large amount of either gynecomastia or pseudogynecomastia, and we're worried about excess skin after we remove the tissue or the muscle, it's very reasonable for someone who has had an excision or a liposuction in the past on their chest to come back and pursue skin excision on their chest, male body contouring. So what we do is we have an idea of what a masculine chest looks like, and we make our incisions to match the normal curvature of the lower pec on a male, so that even though the incisions are plainly visible, they tend to mimic a skin fold that exists naturally in a male. So whether you're pursuing liposuction or direct excision with a skin excision of the glandular tissue and the excess skin, both forms of gynecomastia are addressed appropriately. So we have options in our tool bag to deal with whatever problem that you personally are dealing with. So the recovery is fairly manageable, normally 1 to 2 weeks. We have you wear a tight-fitting compression garment for 6 weeks following the surgery to prevent any accumulation of fluid underneath your skin. The liposuction makes you a little bit tender when you wake up, but it's nothing to write home about. It's very tolerable. And that's gynecomastia treatment in a nutshell. Once again, I'm Dr. Michael Sistare. I invite you to come speak with me a little bit more about this personally. Consults are free. Just call to the office and make an appointment. I'm happy that you had the opportunity to watch another one of my videos. Thank you so much. Once again, the practice is Palm Beach Cosmetic Surgery, and we'll see you next time.